My question is to the Premier. Speaker, the new COVID variants of concern are spreading like wildfire in London. Between March 28th and April 3rd, nearly 30% of COVID tests from the N6A postal code came back as positive, making it the highest in the province. And yet the Premier is dragging his feet, sitting on his wallet, and has not declared N6A a hotspot. On April 12th, the members from London Fanshawe, London West and I wrote to the Premier asking him to declare N6A a hotspot and to stop the spread by introducing mobile vaccination units and more funding for contact tracing and testing. We've heard no response from the Premier despite the urgency of this issue. Will the Premier declare N6A a hotspot and commit to providing whatever resources are necessary to get these new variants under control?
Mr. Hill.
Thank you very much, Speaker. I thank the member for the question. What we have done is identified 114 hotspots in different parts of the province based on the criteria that I've outlined earlier, historic data, areas of risk, and so on. As we will be receiving more supplies of vaccine, we will be able to designate more hotspots, but we need to make sure, given the concerns that we've had with respect to the vaccines coming in on time, to make sure that we have sufficient quantities of the vaccines to be able to provide the vaccines in those areas. But we are doing whatever we can in order to make sure that we can maintain space in our hospitals, that we can do the testing that we need to do, including some of the rapid testing, to try and reduce the transmission of the variants of concern, which are, you're absolutely right, they're moving very quickly. They're more difficult to deal with. They're more hostile.
Response?
They result in more hospitalizations, more ICU beds being occupied, and unfortunately more deaths. So we are taking every step that we can to make sure that we have the capacity both in terms of hospitals as well as vaccine supply to deal with it.
Supplementary.
Back to the Premier. Time is of the essence. Dithering and delaying will cost people their lives. Go to the Science Advisory Table and designate London's N6A as a hotspot. London Health Sciences Centre has been caring for patients from the GTA, in addition to Londoners with COVID. Our ICU has the highest number of people in critical care on record, and now our hospitals have had to cancel surgical procedures. Our health unit is now counting on Londoners to do their own contact tracing because they're overwhelmed trying to track down cases with the new variants of concern. We need provincial support now. London is doing its part to help the province, and now the province needs to help London. Will the Premier stop ignoring London, declare it a hotspot, and provide our community with the resources it needs today?
Mr. Health.
Well, no part of Ontario is being ignored, including London. We have already provided extra contact tracers to many parts of the province to allow them to follow up on the cases. But you're absolutely right. The variants of concern are moving very quickly, and we need to be very nimble and move quickly to respond to them, which is what we are doing, which is why we declared the state of emergency and implemented the stay-at-home order, which is why we are redeploying staff from other parts of the province to work in the hotspot areas, which is why we're also transferring patients from one part of the province to other hospitals, trying to keep them as close as possible to their home zone, recognizing that it's hard for them to be away from their families, and making sure that we had to ramp down the hospitalizations and the surgical procedures and diagnostic procedures in order to provide space in our hospitals for COVID patients, still caring for those other patients as well. So we are moving quickly. We are responding to the need. We are responding to the increase in the variants, and we'll do whatever we can to protect the health and safety of all.